Well, thank you so much. Appreciate you all being here. I am indeed Margaret Calacci. I don't look like that picture. It's been a long year. Just kidding. It's been a great year for us. On behalf of a larger group of my colleagues and interprofessional education and certainly interprofessional simulation is not just me. It is a massive group of people that are involved. And I'd also like to thank one of my great mentors, Bunny Kastenbaum, who's in the crowd today too, who started this all off for Edson several years ago. So I'm a connector. I am a person that finds ways to bring people together. And I see things that could happen, and this is one of those great areas of interprofessional education where I see something like what Angel is doing or what Craig is going to discuss in systems thinking, or I talk with Joe about how we can bring these deserts together and we can put it into an educational event where students can learn and fail forward. They can practice in a psychologically safe space. So team dynamics includes understanding patterns of communication, of conflict resolution, of cooperation, certainly of collaboration, and how to affect that outcome. This is not a new topic. As you can see, most of us learned this at some point in our childhood. To expand those interprofessional team-based healthcare uses, we have to build intentional activities within our programs, and this can happen in either a clinical practice site or in an education site so that we can develop those positive patient outcomes. Interprofessional education is defined that when two or more people, professionals, learn about, with, or from one another, that we can effectively support positive patient outcomes and interprofessional well-being as a social value to prevent errors. So the focus of team-based collaborative care models came into practice in the early 2000s. Many of you are aware of the IOM report, To Err is Human, which realized that there was a system failure in many ways, and this was their attempt to improve positive patient outcomes and decrease cost. However, today we are still looking at approximately 400,000 deaths due to medical or preventable mistakes in the United States. Worldwide, this is even larger because it's not really documented. This still remains a major problem and where simulation education can support positive outcomes. As organizations seek to build capacity to improve safety education research agendas, we must combine the curriculum to facilitate outcomes that decrease bias, improve communication, as we've talked about in previous presentations, and the culture to improve safe patient outcomes. Simulation has become a standard teaching practice and learning strategy in all of healthcare education. The problem-based learning across diverse practice settings allows for active learner engagement, critical thinking, effective communication, teamwork, and leadership. According to allied marketing groups, they have estimated that healthcare simulation will reach a market cap of $7.7 billion by 2027. It's a pretty big number, and I'm happy to be a part of that. At Edson, we provide undergraduate clinical experiences of 50% in high fidelity simulation. In our DMP population, they also have several events where they're using standardized patients as their clinical practice. Many professions outside of nursing, including nutrition, speech, pathology, spiritual care, and medical students and social workers have been a part of our learning process. With a focus on expanding ASU health, Edson is taking the lead in interprofessional education. Simulation, with a focus on high-tech modalities such as virtual and augmented reality, will expand learning to where we can even bring it to learn where you live. We are currently investigating, and I think we've purchased a mobile van, so we will be going around the state with our simulation process. As I said, I'm one of many people that are involved in this process. Edson supports the goals of interprofessional education and simulation with 2 centers, both the Gray Center that was already mentioned. That's Dr. Tommy Parson leads that group, and he is working in emerging technologies such as augmented reality. And then we also have another center, the Center for Advancing Interprofessional Practice, Education, and Research, and that's followed by Margaret Calacci. They provide strategies for training and education to increase understanding of team collaboration and its impact on healthcare. I think we've heard today from many of our researchers and from our audience members that we need to improve our interprofessional connections, and I believe that this is one way to do it. We can continue to promote capacity for building simulation educators as well through our master's program and certificate program for simulation healthcare and operations specialist opportunities. I'd like to thank you for your time and your consideration today. I'll be around, as everyone else will, to chat about this. Maybe something is just kind of brewing and you're thinking about how you can bring this to your practice settings. I would love to engage in that conversation. As I said, I'm a connector. I don't have all the answers, but I certainly can find somebody that can help you out. Thank you so much.